Here we go with another research review by Dr. Zach Walston, Strategies to Reduce Fear of Movement. Fear of movement and avoidance behaviors are associated with poor responses to treatment and clinical outcomes. This study uses a clinical case to accomplish four goals: demonstrate within-person discrepancies in fear and avoidance behaviors, explain the importance of interpreting individual items rather than total scores of self-measurements of fear of movement to better guide treatment, demonstrate an in-depth behavioral assessment that identifies safety behaviors, and to design behavioral treatments that are informed by a person-centered assessment of fear of movement and avoidance behaviors. When performing person-centered evaluation, it includes it's vital to understand the patient's perspective and specific context of their fear and movement and avoidance behaviors. Questionnaires can provide some guidance, but the total score may be misleading. A patient may score high in a specific measure relating to an important task, but score low overall, leading the therapist to dismiss fear as a potential concern. Patients often present with avoidance behaviors that are context-specific and not universal to all situations. Eva presented with low back pain and feared lumbar flexion in some activities, but not others. Avoidance behaviors included no longer dancing with her daughter. She used safety behaviors such as positioning her steer in a high position so she can remain upright while cycling for exercise. The cycling was modified but continued because of her value of exercising with her husband outweighed her fear of pain and harm. The reverse was true for cleaning the house, so that activity was discontinued. Safety behaviors may help with increasing activity in the short term, but they can lead to long-term impairments by strengthening fear of the original activity. Exposure therapy, for example, purposely lifting with a rounded back in a controlled environment, teaches someone to confront the feared movement. When they completed the tasks without the feared event occurring, spike in pain or injury, the fear reduces. A goal is to maximize expectancy violation during exposure therapy. Check out the full article to see more specific examples of how to address fear of movement. Thanks to Dr. Zach Walston again for this research review.